This episode of the Pain Education Corner is sponsored by the Camella Foundation. The Camella Foundation is committed to relieving pain naturally using osteopathic healing principles. Here at the Camella Foundation, we envision a world where people achieve their maximum potential by being empowered with knowledge and skills to heal themselves and others. This information is to be used for educational purposes only and not to be construed as medical advice. If you have any questions or concerns, please consult a licensed healthcare professional. Hello and welcome to the Pain Education Corner podcast. My name is Bill Paravano. I'm here on behalf of the Camella Foundation, where our mission here is being committed to relieving pain naturally using osteopathic healing principles. Today's special guest comes to us from the great state of Nevada. He is an osteopathic physician. He graduated from Pikeville College, the Pikeville College School of Osteopathic Medicine in 2004. He has students and given presentations around the world in such countries as Australia, Ukraine, and New Zealand. The best part of Dr. Beck is the name he refers to be called by his patients, which is Charlie. So myself, on behalf of the Camella Foundation, would like to thank you for being here today, Dr. Beck. Charlie. So welcome.
Thank you, Bill. And the first thing I'm going to say is that you are geographically challenged. I'm in Indiana, not Nevada.
Did I say Nevada?
You did.
Okay.
It's all right. It's not a big deal.
Indiana, and I did know that. Okay. Today we're going to talk about the subject of back pain. So that's something that you specialize in, working with the entire body, and you know a lot about the back. And I really wanted to get in there and dig in on your background, your experience of working with back pain, and how someone who is suffering with back pain can get a better understanding and grasp of what they're dealing with. Because a lot of times pain could be overwhelming, confusing, could leave you kind of hopeless, helpless, frustrated. And I like to be able to draw that information out of you, both from your own personal experience and with working with patients over the past, 16 years, 17 years, in terms of helping people with back pain. So let's start at the beginning. What inspired you to get involved in osteopathic medicine?
Well, the answer that I always give is this. It was divine inspiration.
Divine inspiration.
Yes. So when I was going through college, kind of knew I wanted to be a doctor and didn't know anything about osteopathy. And so I applied to MD school and promptly didn't get in, and applied again and promptly didn't get in, and kind of gave up on my dream of being a doctor for a while. And then when I applied again, I was talking to a friend who was a retired cardiothoracic surgeon and was on the admissions committee at Michigan State. And Michigan State has both an MD and a DO school. And I was telling him what I did and had been doing since the last time I applied. And he said, I'm just going to be blunt with you. The MDs don't want you. Have you thought about being a DO? And I said, what's that? Because I'd honestly never heard of it. And when he explained it to me, it made so much sense. And I kind of knew that's what I wanted to do. So I applied to DO schools and was accepted at Pikeville and did my education there.
And how do you see, because you wanted to go to be an MD first, how does an MD differ from a DO, and what that doctor said? Like what did that, the individuals that gave you the inspiration for that?
Yeah, the biggest difference is that MDs don't get taught much about the musculoskeletal system. I mean, they have to learn it for anatomy class, but they don't get taught what it does. You know, the rib cage protects the heart and the lungs. That's about it. The bones of the head are fused, and musculoskeletal injuries fall into the purview of the orthopedist or the physical therapist. And what we do as DOs is so much deeper than that. So that's the biggest difference. Medicine-wise, we're pretty much equal. We as DOs can prescribe same as MDs do in all 50 states. We can do surgery. We can do brain surgery. We can do foot surgery. We can be orthopedists. We can be OBGYNs. So in that respect, we are interchangeable. It's where it comes to the musculoskeletal system that osteopaths learn more and are able to do more than most of our MD counterparts.
Mm-hmm. So in that understanding, that differentiation between MD and DO, was it the depth of understanding? I'm trying to get a grasp on the piece that made the big difference for you to go in the DO direction.
Well, I originally thought that I was going to become an MD and then go to chiropractic school and be able to do both. And that's an 8-year curriculum, just in the school training, not including residency. And when it was explained to me I could do it all in 4 years in a DO school, and okay, sign me up. Mm-hmm. And that's what made the difference, not knowing anything about it. And then once I got into school, it totally made sense. It fit with all the things I'd done in my life up until that point. And it just felt like that's where my path in life was.
Mm-hmm. And is it an integrated approach that you're referring to?
Yes, an integrated approach in understanding how things work, but also in being able to know and apply more about the musculoskeletal system as a physician.
Got it. Could you give, in relationship to back pain, you have this musculoskeletal perspective, this deeper understanding of the musculoskeletal system as it relates to back pain. Patient comes in to see you for the first time. How are you going to be looking at them differently than an MD would?
That one's pretty simple. So in my training in school, I learned a simple equation, and it is host, which is the body, plus disease, which is what we treat with medicine and surgery, equals the illness, which is the symptoms that the patient has. Traditionally, as an MD, you're going to look at the things that can be treated with medicine and surgery. And some people fit into that category. If you don't fit into that category and you've tried physical therapy and you've tried medicine, and in some cases you've tried surgery, your pain doesn't go away, then with our equation, it's because it's related to your body. And it just hasn't been looked at correctly to get the diagnosis that leads to the cure.
Mm-hmm. Someone has back pain. They come to see you. They don't fit into the category for prescription drugs, shots, or surgery. How are you going to be able to help them?
Well, the first thing that I do is take a thorough history, just as any other doctor would. I'm looking to make sure that all the boxes have been checked and that medically they have been well looked after, so that nothing obviously has been missed. Then I put my hands on and I check to see how the body's moving or not moving. And depending on where it's moving and not moving leads me to a treatment. And the treatment is designed to restore the places that are not moving to normal motion.
Mm-hmm. So one of the common complaints, people that I talk to, they would say they have a herniated disc in their back, lower back, L1, L2, 3, 4, 5, somewhere around in there. They have a herniated disc. You're going to be looking where the body is moving as well as it's not moving. What are some of the patterns that you see kind of present themselves?
Well, I'm going to have to back you up here.
Okay.
If we're just talking about a herniated disc.
Okay.
So in the 1930s, I think it was, Buckminster Fuller, the guy who gave us buckyballs and geodesic domes, mm-hmm. starts working on this idea called tensegrity, mm-hmm. which is an architectural term combining tensional and integrity. Mm-hmm. And Donald Ingber, who I want to say, if I remember correctly, trained at Yale but works at Harvard in cell biology, proved that the cellular structure of the body, going from individual cells all the way up to the whole, the body works on a tensegrity system. Now, if we take the complex stuff out of it, it's self-supporting, which basically means that it's an anti-gravity device. So when you stand, gravity is trying to compress you. Tensegrity is trying to lift you up. And the life that we experience is somewhere in between those two. If your body's working correctly, everything literally floats in relationship to its neighbor. So when you say herniated disc, the first thing that I hear is that in order for that disc to herniate, your tensegrity structure is not working correctly. The disc, as I have understood it in my training and in the classes that I've taken, is a fail-safe device. It should last your entire life and technically never be needed because the vertebrae of the spine float in relationship to one another. So if you have done something which has allowed the spine to compress enough to basically explode that intervertebral disc, which is what a disc herniation is, then you have told me simply by your diagnosis that my tensegrity structure is not working correctly. Thus, my job is to figure out why and restore that tensegrity structure to a more working and self-supporting, thus floating scenario that takes the pressure off the disc, no surgery required, and can, this is not saying every case because some people actually do need surgery, but it can completely relieve that pain and pressure with no surgery required.
And so many questions. This is great stuff. There's a gradient, what I hear you saying. The tensegrity structure begins to collapse, which causes the pressure on the disc or discs in a certain area of the body. And then over time begins to get worse. Would that be fair to say?
The time period could be seconds.
Okay.
Or it could be years.
Okay. So seconds could be injury. They fell, landed wrong on their feet, fell off a ladder, off of a roof, something along those lines.
Correct.
So that could be the seconds. Over years could be, I lost my parents. Stress got to my life over a period of time, so it caused me to hold my body differently, caused the wearing and rubbing of the discs, and the discs begin to herniate.
Correct.
Okay. When I work with clients, I'm always saying, make sure you go to a doctor, whoever that is, to determine if something is broken or torn in that scenario, to make sure you don't need surgery, that there isn't something mechanically wrong.
Correct.
So you go to the doctor, you make sure, basically a green light, that this is something that the body can recover from. Is that,
well, you go to the doctor, and with the technology that we have today, you get a diagnosis.
Correct.
Now, what's very interesting, I try to make my analogies back to things that people understand.
Sure.
Our current ability to see inside the body and how it moves equates to sitting behind the wheel of your car with the keys in the ignition and trying to determine if the front wheels are in alignment. You don't get to start the car. You don't get to drive it. We get to take a still picture. Okay? And people will go, oh, yeah, well, wait a minute. That doesn't work for determining the alignment of the car. True. We got to roll the wheels. We got to see what happens when it's actually moving. And we may be at that place in the way technology is advancing 10 years, but we're not today. So what happens is we try as physicians to make a diagnosis that relies on learning how you move or don't move with static pictures. There's a lot of guesswork involved, and on our best days, we might get it right. On days when we're human as doctors, we might fail more often than not.
Got it. Okay. The direction of my question was, how can a person, because you've put together a bonus for our listeners / watchers today. How can they determine? Because I want to make sure someone isn't coming straight off the internet, finding this video and going, well, I got this herniated disc in my back and I could take care of it myself after watching or listening to this podcast. That's my concern. I want to back up a little bit and make sure somebody doesn't have parts floating around in their back and they're trying to fix themselves. So I'm trying to get this window between the stress came on at some point in time that has caused a gradual degeneration of what's going on in the back.
Sure.
Before we've gotten to a mechanical dysfunction in a way that would require surgery. So we got a gap in there that I want to make a distinction in the listener's mind that is going, oh, I need to go see a doctor now, or this could possibly help me relieve my back pain. So that was the direction of my questioning. Probably should have been a little clearer up front.
Okay. So the things that would send you to a doctor right away. So this is do not pass go, do not collect $200, get in the car, go to the ER.
Yes.
Is a big change in either urination or bowel habits. So can't pee, can't poop, I'm in pain. That is a surgical emergency. Okay. Back pain that is unrelenting. Really, it could be more annoying than actually painful, but no way that you can move your body makes it go away or diminish.
Mm-hmm.
That's also a trip to get imaging studies and make sure that you don't have anything that's surgically wrong.
Mm-hmm.
If your back pain is present at some times, or maybe it's if I do this one thing, it gets worse. If I do this other thing, it gets a little better. Those scenarios usually are not run to the emergency room. Mm-hmm. That's a stop, take a couple of deep breaths, figure out what's going on as best you can, and then make decisions. Mm-hmm. So that last scenario where your back pain is present, not all the time, it's not debilitating. Maybe it's a 1 or a 2. When you wake up, it's a 5 or 6, or when you do this, I shovel snow, it's a 7 or an 8, but then it goes back to something else. Those are the things where you can wait, do the exercises, the program that we're going to offer, and see if it makes a change. Mm-hmm. And if it makes a change, and the change is for the better, obviously that's what we're looking for, mm-hmm. then you can keep doing the exercise, follow the program, and you may be able to take care of that back pain on your own. Mm-hmm. If it completely goes away and you're pain-free, wonderful. Mm-hmm. If we turn down the volume and it's something that's manageable, but it doesn't take it away, mm-hmm. what we've done is bought you a little more time so that you can figure out who you want to go see. And then you make an appointment with the doctor and you go and get evaluated and get treated. Mm-hmm.
That sounds like a great strategy. The piece that I'd like you to go a little deeper on, and what I've been touching with clients, is the part of preventative maintenance. When the pain starts diminishing, where the mind starts to go, oh, well, I don't need to follow this through.
Yes,
It's like when I'm in acute pain, it's like a crisis. And I
absolutely.
do something yesterday, and I want to be out of pain right now. And then the moment the pain starts to diminish some, and it's not so up in their face all the time, when people kind of, out of sight, out of mind kind of deal, where they
Oh,
really
absolutely.
don't address the issue. And I think that is, I'd like you to talk to that person, because I think it leads to this recurring being on a hamster wheel of, it's like nothing ever works for my back pain.
Absolutely. Let's go back to car analogy.
Okay.
There is this little gauge on the dashboard which has an E and an F on it,
Yes.
and usually a picture of a gas tank with an arrow pointing to the left or the right.
Mm-hmm.
Okay. Now, what we can do is, every couple of 100 miles, we can add this thing they call fuel. We can basically do our preventive maintenance. And the little red light, which tells us that we've driven too far and we're ready to become an idiot, comes on. If we ignore the red light,
Yes.
suddenly we're walking
Mm-hmm.
to get more fuel and get the car running again. And we're hoping we haven't done damage to the engine. Okay?
Right.
And that makes sense to everyone because we live that every day.
Mm-hmm.
Well, you live in your body. And so you can do preventive maintenance as we go along, and your body will give you many, many, many more miles before it needs a major overhaul. Or you can not do the preventive maintenance and suffer.
Yeah. And I really see that as our conventional medical model right now, that it's like people are just beating the hell out of their bodies and not doing any maintenance on it, not taking care of, checking the oil and the fuel and the battery levels and the brake pads, all of the fluids in the car. They're not doing it on a
Correct.
regular basis. And then when it gets to crisis mode, now they're running to the doctor, and they're in this paradigm of drug shot surgery, painful physical therapy that just kind of leaves them in the same place.
Correct.
Over and over again. So I wanted you to speak to that, because you're coming at health, healing pain, back pain, especially today, in a very different approach, looking at it from your tensegrity structure model and the understanding of the interconnected series of pulleys and levers that the body is, that keeps it in balance or out of balance. And it doesn't matter, short of something being broken or torn, that we have the ability as human beings to reestablish that tensegrity structure, get it back into balance, and get ourselves out of pain.
Right.
Cool. It always comes so much better from a doctor. Okay. You see someone suffering with back pain. What do you see is usually their biggest challenge, if we didn't already cover it?
Oh, goodness. You've asked an open-ended question that might take 4 or 5 days to actually give you the answer.
Okay.
I'll try to condense it.
Okay.
So in osteopathy, we learn a thing called the osteopathic triune. And so it's a triangle, and at each apex of the triangle is mind, body, and spirit.
Mm-hmm.
We talk about this thing called a key lesion or a primary lesion.
Mm-hmm.
And so when you walk into the door in my office, the first question I'm asking of myself about you before we ever talk is it mind, body, or spirit?
Mm.
Okay, so if it's body, it's actually simple. Okay,
Mm-hmm.
and we'll just say you tweaked your knee, and that's giving you back pain, and it's really direct. I listen to your story, and there's nothing else going on. That one's pretty straightforward. I treat your knee. We make sure your back is right. We send you on your way. The other two are more complex.
Mm-hmm.
And so what we learn in medical school about spirit is that folks who follow Jehovah's Witnesses don't do blood products. So in an ER situation, they don't want blood.
Mm-hmm.
That literally is what we learn about spirit. And over time, I've had to listen to my patients over and over again and realize that spirit is actually our belief system.
Mm-hmm.
And it doesn't just cover whatever you believe about religion, but it's how you believe about the world. So, I mean, for example, if we go and we look at the pandemic that we're in right now, at the beginning of the pandemic, you and I have grown up with this belief system that toilet paper will always be on the shelf. And if you walk into a store and toilet paper is not there, it can challenge your belief system,
Mm-hmm.
which can show up physically in the body.
Okay.
And so that I ask you about your belief system, not directly, but I'm listening to what you're saying and how you're saying it, so I can kind of read between the lines.
Mm-hmm.
And if your belief system is the challenge, and the example I gave, well, I might give you a couple rolls of toilet paper, and it actually might solve your problem.
Huh.
If emotion is the big issue, and let's just say your beloved pet passed away, and you can't really tell your story because no one will listen,
Mm-hmm.
that also can show up physically. And so my job is to figure out how to hear your story in a way that's meaningful to you.
Mm-hmm.
Now that's my first job. Mind, body, or spirit. What portion do you have of each, and how can I help you?
Mm-hmm.
Once we get that sorted out, then I palpate your body. We figure out how it's showing up physically, because that's primarily how I work.
Mm-hmm.
And then we get that sorted out.
Bless you.
Talking too much without a drink. There we go. That's better.
And is there, of those three, do you find the majority of people falling into one of those categories, that it minimizes or eliminates the others?
Goodness, I'm going to have to give you a double answer. Yes and no.
Okay. That's
Sometimes,
the only two.
Yeah, right. Sometimes it is actually very clear.
Okay.
Other times people have a mixture.
Mm-hmm.
Their body is giving them a message. And all right, so I'll give you a scenario that came from my clinic years ago.
Mm-hmm.
I, for a number of years, went to New Zealand every year. And when my colleague there went on vacation, I would go in and take over his practice for 2 weeks or so. And it was a change of scenery for me, and I'd, sightsee on the days off. So I would get to, let's just say you came in as a patient. I get about 2 minutes to review your chart, find out what's been going on with you, and then I treat you.
Mm-hmm.
So I had a woman come in. Her history was, fell downstairs, hit right side of head. Hit right side of head on fire escape. This is another visit.
Mm-hmm.
And I'm thinking to myself, pattern. And then she comes in because she hit the right side of her head a third time.
Mm-hmm.
Now, I just met this woman, and here's the way it works in my practice. I said, well, I've only just met you, but this is what I'm hearing. In Chinese medicine, the right side of the body is masculine energy. The left side is feminine energy. And is there, honest to God, a man in your life that you feel like you are banging your head against? That was it.
Mm-hmm.
Instant tears from the patient.
Mm-hmm.
I've only met her for about 3 minutes now.
Mm-hmm.
And, what comes out is she's in a relationship that doesn't work. Her body was telling her. It just wasn't in a way that she understood. And all I acted in that case was as the translator.
Mm-hmm.
So I treated her. And she came back the next week and she said, I changed my relationship and I feel amazing.
Mm.
So that is a way that the physical can show up, because there's something going on that's deeper that this patient needed help with.
Mm-hmm.
And in other cases, it's, purely physical.
He just fell on the right side 3 times.
Correct. Exactly.
Yeah, I believe there's the ability to get stuck into looking at the deeper meaning as to what's going on, and it still could be.
Oh yeah.
Well,
Sometimes it's incredibly simple.
Yeah, it just fell and hit my knee. So, okay, well, great. So, can you share with the listeners today the bonus? What would inspire them to click the button below this video that is going to lead them to the bonus material?
Oh goodness. Well,
What you got?
let me explain kind of how this worked out.
Okay.
So what I got taught in school nearly 20 years ago, been using in my practice, since medical school, treated lots and lots of people. And I was doing exactly what I was taught, kind of in the back of my mind, not paying much attention because it's the same over and over again. And I asked a patient to do something, and this will be explained in the video, and they did it. And all of a sudden I got a different answer to the test that I'd just given a couple of minutes before. And it made me start pondering, I wonder what's happening inside the body. Mm-hmm. And so out of this came the idea for what we're presenting in the video. And what I found out was, wow, I've been making the treatment hard. Mm-hmm. Now, the treatment that I was giving is way easier than what most people give, but it didn't even have to be that hard. Mm-hmm. So I could come up with a treatment that was literally based upon bending forward, mm-hmm. just with your legs and your body in a very precise position, mm-hmm. and you could treat yourself. Started working with it on my patients. It worked every single time. Cool. I was flabbergasted. Mm-hmm. And I've been working with that, expanding it to more and more parts of the body as time has gone on. And mm-hmm. that's what you're going to learn in the video. Kind of how to position your body in such a way that when you bend forward, it's actually doing something very productive.
So we're tying it back into what you talked about at the beginning. We're engaging the tensegrity structure in such a way that will allow it to release itself.
Absolutely. And hopefully take care of your back pain.
Cool. And is this going to be upper back pain, lower back pain, any back pain?
I'm going to say that it depends on how things are connected, mm-hmm. but let's start with the beginning. We're focusing on lower back pain, okay, because that's what most people experience. But the same principles are going to work for upper back pain. It's just going to be a little more detailed.
Cool. Well, maybe we'll inspire you to have another future podcast with us that will dig into upper back pain. Talk about that a little bit more.
Sounds great.
So is there anything else you would like to share? How do people get in touch with you?
Website, which is osteopathicvision.com, mm-hmm. osteopathicvision. And that's got my email address on it and the office phone number. So mm-hmm. that's the easiest way to reach me.
Okay. We'll have all this information in the show notes of the video, audio, whatever you're listening to or watching. So we'll have all of Dr. Beck's contact information as well. Any other closing remarks you'd like to share with anybody suffering with back pain?
Well, first of all, I'd like to say thanks for having me. And if you're suffering with back pain, there is hope.
And you could also go see Dr. Beck in person in his office in Indianapolis, not Nevada.
Correct.
Not Nevada.
Correct.
Well, great. Charlie, thank you so much for being here today. This is Bill Paravano on behalf of the Camella Foundation. Thank you so much for listening, and we will see you on the next podcast.
Thank you, Bill.
Thank you for tuning into this week's segment of the Pain Education Corner. To learn more about the work we do at the Camella Foundation, please visit our website at the Camella, COMELLA, foundation.org. Join us next week for another conversation on natural healing methods to eliminate pain.